Afternoon, folks. This is going to be our hybrid content for the week, picking up where we left off, talking about skeletal pathologies and skeletal fractures. So we've now dealt with bone growth, bone formation. It's time to start taking a look at what happens when bone is damaged or some common pathologies of the skeleton. Now, we're still in the same handout if you're following along with my handouts from the other day. But start taking a look at the issue of bone fractures. Now, many of you experienced a bone fracture at some point in your lifetime or have known somebody who has experienced a bone fracture, and there's more than one kind of bone fracture. We, of course, have most commonly you deal with stress fractures. Stress fractures are caused by any sort of trauma to the skeleton. This is what normally happens when somebody gets a broken arm or broken leg from a fall or an athletic injury or something like that. Much more serious is when you have a pathologic fracture. Pathologic fractures happen when the skeleton is weakened for some reason, and things that would normally not be traumatic to it, if the skeleton was healthy, cause enough trauma to break a bone. So that I say is a more serious situation because it requires the bone to have been severely weakened in the first place. And that requires some sort of very serious underlying problem, a skeletal disease, severe malnutrition, something like that, which is usually a much more severe underlying systemic issue that needs to be addressed rather than just a one-time incidence of trauma. Now, there are a lot of ways you can talk about bone fractures that we're not going to go into in here. If you take courses in emergency medicine or anything like that, you'll talk about different categories of fracture based on the direction of the fracture, how badly the bone is broken, whether or not the skin is broken along the way or not. I talk about compound fractures, green stick fractures, torsion fractures, a lot of other different kinds of fractures based on those sorts of things. We're not going to get into that in here. Um, but I do want to talk a little bit about how the body itself deals with a fracture. Now, the process by which the body heals from a fracture, in general, takes approximately 8 to 12 weeks in a healthy adult. Now, that's an average figure. That will be shorter for small fractures like a crack in the bone, shorter for fractures in very small bones, like, say, fractures in this tiny flat nasal bones. That will be longer periods for more severe fractures where the bone is badly fragmented or crushed. Longer for fractures in larger and thicker bones. Broken femurs and pelvic bones, for example, are going to take longer to heal. The more complex the fracture is, the longer the healing process. If the fracture is poorly stabilized, that is, if it's not set or splinted properly, it's going to take longer to heal. In general, kids and adolescents will experience faster healing with less likelihood of long-term complications. In general, elderly folks are going to experience slower healing with a greater likelihood of long-term complication. Regardless of the type of fracture, the complexity of the fracture, or the age of the patients, fracture healing proceeds in 4 basic stages. First stage is often referred to as hematoma formation. What happens immediately after the bone is broken? The broken blood vessels are going to, of course, be bleeding internally, and they're going to form a thick clot around the site of the injury. Obviously, the blood is going to be clotting before anything else happens. That's the body's initial response to any injury. And it's going to form a large internal blood clot or bruise around the injured bone, which we call the fracture hematoma. And that has to happen before anything else. The body has to get the bleeding under control. Bone itself, of course, experiences bleeding from its own internal network of blood vessels, and very often the tissue surrounding the bone will be ruptured as a result of the break in the bone, too. Now, following that, we move on to what is often called granulation tissue formation, during which we're going to form what is often called the fibrocartilaginous callus. And if you refer to my handout for today, you'll get that full term. And the fibrocartilaginous callus is going to be the first stage of bone healing. Now, what's going to happen here is that fracture hematoma around the site of injury is going to be invaded by newly formed blood capillaries that will grow into the hematoma. Those newly formed capillaries, those blood vessels, will start bringing in all the stuff that is needed to repair the broken bone. That is going to include fibroblasts, osteoblasts, osteoclasts, and macrophages. Collectively, all of those cells that are needed to repair the broken bone, we refer to as the osteogenics. Once those things are present, the fibroblasts are going to begin secreting soft, fibrous tissue into the fracture hematoma, starting to fill in the gap in the broken bone. This soft tissue, combined with all of these newly arrived cells and the new capillaries that have grown into the area, are what we collectively call the granulation tissue. Little by little, we begin filling in the gap in the broken bone, forming a soft, fibrous tissue mass that is called the fibrocartilaginous callus, or sometimes the soft callus. And that soft callus begins to join the two ends of the broken bone together, or begins joining up the fragments of broken bone if it's more badly fragmented than that. Now that we have that soft callus in place, move on to step 3, which is the formation of the bony callus or hard callus. Once the fragments of broken bone are joined up by this mass of soft fibrous tissue, osteoblasts are going to begin depositing minerals within it. The soft callus is going to gradually harden and going to form a bony collar of sorts that we refer to as the bony callus or hard callus around the site of the injury. Gradually, this bony mass is going to fuse together the broken ends of the bone. And little by little, that soft callus is going to become more and more ossified. But just adding minerals to the soft callus is not going to make it fully healed as bone. The final step is bone remodeling. During bone remodeling, osteoclasts and macrophages are going to clean up the site of injury. They're going to dissolve broken bone fragments in the area and clean up any dead cells and tissue in the site of the injury. Any gaps left behind when broken bone fragments are dissolved away are going to be initially filled in with spongy bone, and then that spongy bone will slowly be filled in with minerals and remodeled by osteoclasts into compact bone. The combination of filling in gaps with minerals and compact bone, sculpting it and smoothing it, will gradually shape it into the bone or some approximation of the bone that it was before. It will usually be a pretty close match to the original shape, assuming the bone was set properly. If the bone was not set properly, it may not be a perfect match for the original shape. It will often have a smoother appearance than it did originally, and therefore will often be distinguishable at the site of the injury. You'll often see permanent marks at the site of the injury that are a bit thicker than the bone originally was there. And very often in adult bone, you will find that spot is weaker than it was before. You're more likely to re-break the bone at that spot where it was broken before than you are to fracture it again at previous spots. I'm sorry, at new spots. Now, in juvenile bone, in bones of kids and adolescents that are still growing, very often fractures will be healed over with no lasting signs. The new healing will be subsumed in bony growth that's normally part of your growth as you mature. And very often that means that breaks along the way will just be completely obliterated, and the bone will be healthy as if it had never been broken. Very severe childhood breaks might leave marks on the bone, but it's not at all unusual for juvenile breaks, particularly in young kids, to leave no lasting marks into adulthood. Sometimes they do. Adult fractures will often leave a mark in the bone that lasts for the rest of your life. And sometimes that can be useful in a forensic context. If, for example, somebody's gone missing, we find a skeleton somewhere, we're trying to ID it and see if that was the missing person. We can pull up records of known skeletal injuries that person had, look to see if the skeleton exhibits the marks of that same injury as a form of helping to ID them. Now, one way of helping to ensure that bone heals up properly is by setting the fracture. In fact, if a fracture is not set properly, chances are it's going to A, take longer to heal, and B, not going to heal up entirely properly. Keeping the bone fragments close together ensures good healing, rapid healing, and that the bone heals into the right shape and not at a bad angle. If you're lucky, you'll be able to set the bone with what we call closed reduction. That is non-surgically manipulating the fragments of bone into place and setting them with splints or casts. At one time, the cast was a big, heavy plaster thing that wrapped all around the structure that was being set. Nowadays, it's often an air cast or a plastic accessory. Sometimes it can be removed temporarily for cleaning the area or whatever. More severe breaks might require open reduction. That is surgical setting of the bone, which frequently involves implantation of some kind of accessories to rejoin bony fragments, such as rods, pins, or screws, plates in some severe cranial injuries. And in some cases, if a bone is set very poorly and has healed poorly, surgical open reduction might require controlled surgical re-breaking of poorly set bones so they can be reset and re-heal the right way. External settings might be as simple as tape. They may be as complex as traction, which is the complete immobilization of the patient's body during part of the healing process. That is often required for cases like hip fractures or spinal fractures. Of course, in those cases, you have to worry about things like muscular atrophy or the patient developing blood clots or dangerous external sores during the healing process, in which case things like electrical stimulation to keep muscle atrophy from happening, massage to prevent blood clots, blood thinners, and things like that. Techniques like that are often employed to help ensure that you don't get secondary complications along the way. Patients who are in traction, especially older patients, are especially at risk for pneumonia. Something like 25% of all hip replacement patients who have to experience traction afterwards get pneumonia. The branch of medicine that is concerned with dealing with musculoskeletal injuries, by the way, is orthopedics, which literally translates as straight foot or straight child, depending on which translation you pick from the Greek. We're not 100% sure which was originally intended when that branch of medicine was named. Now, I'd like to finish up our look at bone tissue by taking a look at a couple of select skeletal pathologies. There are a number of things that can go wrong with the skeleton, and we're not going to talk about all of them, but I want to talk about a few select skeletal diseases that you might encounter, a few things that have some notable impacts on the skeleton. Now, a fairly well-known skeletal disorder, and one that used to be comparatively uncommon, but is unfortunately becoming more common in the modern world. It used to be common in the past, it was uncommon for a while, and it's unfortunately making a comeback, is a condition called rickets. Rickets is a skeletal disorder that is characterized by defective mineralization of bone in children. This causes the bone to be soft and therefore to be deformed as it mineralizes, particularly in the lower limbs, leading to abnormal curvature of those limbs. Also often to kind of knobbly, thickened facial features and curvature in the upper limbs and hands. But it's most noticeable in the lower limbs and can lead to a bow-legged sort of structure. This is often a consequence of malnutrition and inadequate sunlight. Now, in developing countries where adequate nutrition is often hard to come by, rickets has long been a common problem. Here in the United States, for a long time, it was not a terribly common problem, but we're finding a resurgence of rickets in the United States in recent years due to a combination of children not getting adequate calcium and also not getting adequate sunlight. There is an unfortunate tendency of kids to not play outside nearly as often as they did in ages past, and therefore kids are not getting as much sunlight as kids in past generations did, and therefore rickets is developing more and more frequently. There is an adult form of rickets called osteomalacia, which is adult onset rickets, in which minerals get leached from the skeleton, and that leads to deformation of adult bone. It is a relatively rare condition, and it's mostly seen in malnourished women who have had multiple pregnancies and therefore have had calcium leached from their skeletons due to the developing infants. And that can lead to curvature in the lower limbs due to the weight-bearing consequences of that. To give you an idea what this looks like, let me pull up some images for you here. 1 second. This is rickets in children. I don't have a good picture of adult onset osteomalacia, but you can see the distinctive curvature that you get in the formation of the lower limbs due to the poor mineralization that causes weight-bearing to deform the bone as it's forming and leads to that distinctive curvature. Now, another relatively common bone deforming disorder that looks a bit like rickets whenever you see it, comes from a different source, is a condition called osteitis deformans, also known as Paget's disease. People mispronounce it Paget's disease, P-A-G-E-T. It's actually pronounced Paget's disease, but honestly, you're going to mostly hear people call it Paget's disease. Paget's disease is mostly an adult onset condition. It's characterized by disorderly bone growth. It's a combination of excessive osteoblast activity followed by disorderly osteoclast activity. This causes basically disordered bone growth in which excessive bone is laid down and then more bone is dissolved away. And that causes the bone to be irregularly shaped, weakens, and malformed, often with deep curvature, with sharp spurs in the joints, and to have poor weight-bearing capability. Paget's disease is most common in the bones of the pelvic girdle, in the skull, where it can lead to abnormal facial features, in the spine, where it can lead to abnormal curvatures, and in the lower limbs, in which it can cause both curvature similar to what we see in rickets, and also abnormal swelling of the joints, and extreme joint stiffness and pain due to protrusions of bone in the joints of the pelvis and the knees in particular. There's no apparent cause of Paget's disease. The tendency to develop it is hereditary. Unfortunately, there is no known treatments. It seems to be a thing that just pops up in patients where one day they'll begin experiencing this rapid disorderly bone growth. It comes and goes. We do not know why it happens. Here is an X-ray of a patient showing progressive Paget's disease over time, and you can see the deepening curvature of their femur and well, actually, it's just, sorry, excuse me, the tibia, and you can see the worse and worse curvature there developing over time. Now, somewhat less severe pathology, but one that a great many people actually experience. In fact, some of you might actually have one of these, is an osteoma. Osteomas are benign bone tumors. They are small, little smooth masses of bone, kind of little button-like masses. They most often occur on the skull and in the eye sockets. About 1 in 4 people have them. And they're usually just kind of sitting there, not usually doing much of anything. Some variants that you can get on osteomas that are a bit more problematic are osteochondromas. That's abnormal growth of bone into the cartilage in the joints that can cause bone spurs. And the really dangerous form of osteomas, benign bone tumors, are very, very common. A great many people have them. But the dangerous kind, of course, is osteosarcoma. Osteosarcoma is bone cancer. Bone cancer is a comparatively rare cancer for reasons we are not clear on. It is most common in young men. It's actually one of the most common cancers in young men. The vast majority of cases occur in men under the age of 25. We do not know why this is. It seems like it is common in people with a history of bone cancer. And it seems to be comorbid with other skeletal disorders. A lot of patients with bone cancer also experience skeletal growth disorders like Paget's disease. There are not a lot of cases of it. Osteosarcoma, about 3,600 cases a year. Sadly, it's got a very high mortality rates. There are about 1,700 deaths per year from it, so its mortality rate is nearly 50%. It's one of those cancers that by the time it is caught, it is very often spread throughout the body simply because bone marrow is the source of all of our red and white blood cells, and therefore it's quite easy for bone tumors to get into the blood supply and spread throughout the body. It is most common in the tibia, the femur, and the humerus for reasons we are not clear. Now, another very common set of skeletal disorders are abnormal curvature of the spine disorders. And there are 3 of these, depending on how the spine is abnormally curved. Let me pull up my diagram here. There we go. And these are 3 different abnormal curvatures of the spine. On the left here, you can see kyphosis. Kyphosis, which is sometimes called hunchback, is abnormal curvature of the thoracic spine. And you can see the spine is not straight up and down. The spine has an S curve to it, but you can see that kyphosis involves an abnormal degree of posterior curvature in the thoracic spine. That in the lordosis patients here on the right, that's more what the thoracic spine is supposed to look like, but you can see that on the left, it's curved much more deeply than it should, leading to the characteristic hump in the back and the hunching forward of the head and neck. Kyphosis is particularly common in the elderly. It is often a complication of osteoporosis, that the weakening of bone will often lead to gradual curvature of the spine over time due to the weight-bearing quality of the upper spine supporting the weight of the head and neck. You will also sometimes see kyphosis developing in adolescents and young men, particularly those who have done a lot of weight-bearing sports. We often see kyphosis in people who have done too much weight training when they are young men who've done a lot of wrestling, young men who have done a lot of heavy weightlifting are particularly prone to developing kyphosis later in life. Now, the middle diagram here. This is a really common one, scoliosis. Scoliosis is abnormal lateral curvature of the spine, either to the left or to the right. You can see it's to the right side in this diagram here. This is an unusual anatomical diagram, by the way, that we're seeing in posterior view, which means right is actually on the right in this diagram. How severe it is depends on how deeply the spine is curved to the left or right. Scoliosis is particularly common in children. It's often a congenital disorder. And very often it can be treated when the child is young with a back brace, meaning that the child is fitted with a brace that they wear during their growing years, and that can often correct the abnormal growth in the spine while they are young so that the spine grows back into the proper shape. And finally, we have lordosis. Lordosis is abnormal lumbar curvature. You can see here's the normal lumbar curve in our patient with kyphosis. You can see in our lordosis patient, you have a much deeper forward curve of the lumbar spine, causing protrusion of the abdomen. Lordosis is particularly common in patients with heavy abdominal obesity. Also, it is particularly common in pregnant women, particularly women who have had multiple pregnancies while getting inadequate calcium, and therefore leads to deepening curvature of the spine. Lordosis is sometimes called swayback and can lead to postural difficulty and difficulty maintaining balance. And yeah, so these are all some spinal curvature problems that we can get. Now, this goes right into discussion of a thing I believe we talked about a bit in class the other day, and that, of course, is osteoporosis. And I do want to say a few words about that, although we did discuss it in class. This is a really common skeletal disorder that a great many people will experience as they get older. Osteoporosis is the progressive weakening and loss of skeletal mass. Now, everybody loses some amount of skeletal mass with age because, as I said in class the other day, all of us will lose some of our capacity to absorb calcium as we get older. That is a normal part of aging, and that is not osteoporosis. Osteoporosis is a pathologic loss of skeletal mass, particularly the loss of spongy bone. Now, remember, the purpose of spongy bone is to distribute force throughout the skeleton. So if we lose spongy bone mass, then the bone will lose much of its weight-bearing capacity, become more brittle, and more prone to fracture. It is most common in late middle-aged to elderly women, although men are able to get it as well. Men are usually not as severely affected as women, simply because the loss of estrogen causes a more precipitous decline in calcium absorption that men do not experience, because men do not experience the severe hormonal shift that women do with menopause and don't experience as much loss of calcium absorption. A man with osteoporosis might lose 25 to 30% of his skeletal mass. Women with osteoporosis potentially might lose 50% of their skeletal mass. This not only leads to increased risk of fracture, shrinkage of the skeleton. One reason a lot of older people seem to get smaller, but also deformity of the skeleton that leads to problems like kyphosis, so abnormal curvatures that we talked about, or increased risk of malnutrition disorders like rickets, and of course, increased risk of hip fractures, limb fractures, pathologic bone fractures, and so forth that we discussed earlier. Now, I saved a couple of really peculiar skeletal disorders for last year. A very rare bone disorder, a hereditary bone disorder that you will hopefully never have to deal with, is a condition called osteogenesis imperfecta, abbreviated OI, and sometimes called brittle bone disease. This is a hereditary genetic disorder. It is a recessive disorder, has to be inherited from both parents, but they can be carriers, which means they don't necessarily have to know that they have it. This is a condition that causes defective collagen formation in the individual, leading to improper uh, construction of bone that results in the bone being extremely brittle and fragile. Osteogenesis imperfecta leads to extremely brittle bones that snap very, very easily. Many infants with this disorder will break bones during childbirth. And in fact, some babies with this disorder die during childbirth because of severe bone breaks. Individuals with this disorder who survive will experience very frequent broken bones. They will often have mobility issues throughout their lives because of the frequent fractures that they experience. Many of them will be confined to wheelchairs or have to use canes or other accessories because of the severity and frequency of bone fractures that they've experienced. They'll have all the problems that come with breaking bones on a regular basis. Might be breathing difficulties because of frequently broken ribs. Their bodies are constantly in a healing cycle. They break bones from even very minor things. And needless to say, this puts their bodies in a lot of danger. They're always anemic. I mean, imagine that you break bones as easily as you bruise, and that's the danger that you face here. If you want to see a little bit about what life with this disorder could be like, there's actually a fascinating movie, Unbreakable, by M. Night Shyamalan. And Samuel L. Jackson, of all people, in this movie, plays a character with osteogenesis imperfecta. And it's worth checking that movie out. And then finally, one of, I think, the scariest skeletal disorders that exists. Unfortunately, it is a very rare one. Another recessive genetic disorder. Fibrodysplasia ossificans progressiva. Bit of a mouthful of a name there. This is a recessive genetic disorder that causes the gradual ossification of soft tissue. Specifically, the ossification of muscle and soft connective tissues. In other words, patients with this disorder will experience what we call the formation of heterotopic or extraskeletal bone as their muscles and soft connective tissues gradually transform into bone. It is a condition that seems to be exacerbated by injury or illness. It will happen episodically. They'll experience episodes of new bone formation in their soft tissues. It will stop for a little while, then it will flare up again, and more of their soft tissues will ossify. When they're sick, it tends to flare up. When they experience other injuries, it tends to flare up. And little by little, more and more of their soft tissues will turn into bone. They will gradually lose more and more mobility until eventually the condition kills them. There is no treatments. There is no cure. We have no idea why it happens. It's kind of a horrifying condition. And to give you a sense of what this is like, this is the skeleton of someone with fibrodysplasia ossificans progressiva. So if the gods are kind, you will never experience this or know anybody who ever experiences this. Okay. All right. So on that somewhat terrifying note, I think we will call this a lesson. So we have now finished our chapter on bony tissue. And having completed that, I'm going to be making available to you a quiz on bony tissue. I will post that in the near future. You'll have a week to finish that one up in. I'll make that available on Blackboard right after I post this lecture. And then you'll have a week to do that in. I will see you in class on Wednesday. We'll start talking about joints. Sound good? All right. Y'all take care. Have a good rest of your weekend.